Dear students, let us discuss about the stomach bed. In this, we will define what is stomach bed and what are the structures that are forming the stomach bed. Before we start the discussion about the stomach bed, let us review the important points about the stomach. The stomach is located obliquely in the upper and left part of abdomen in relation to the epigastric, left hypochondrium and umbilical regions of the abdomen. This is what you have learned during your classes on stomach. And if you come to the extent of the stomach, it extends from the lower end of esophagus to the duodenum. So that is the extent of the stomach. And if you see the presenting parts of it, it has got two ends, that is the cardiac end and pyloric end. And it has got two curvatures, the lesser curvature that faces to the right and the greater curvature that faces to the left. And it presents two surfaces, the anterosuperior surface, which you will see once you open the abdominal cavity, and the postero-inferior surface, which you cannot see immediately after opening the abdominal cavity reflecting the peritoneum. You can see only the anterosuperior surface. So the postero-inferior surface, for seeing the postero-inferior surface, you have to turn it up. Then only you can see the postero-inferior surface. Now let us define stomach bed. It is one on which the postero-inferior surface of stomach will be lying in supine position. So the stomach bed is the one on which the postero-inferior surface of stomach will be lying in supine position. Okay, the position of the body is important, and the surface that is coming in contact with the structures forming the stomach bed, which we are going to discuss, is the postero-inferior surface. And this postero-inferior surface of stomach is covered with the peritoneum of lesser sac except over the bare area. And in this picture you can see the anterosuperior surface of stomach, which you are seeing. The two ends, the esophageal end, and towards the duodenum is the pyloric end, the lesser curvature towards the right and the greater curvature towards the left. And you can see the peritoneal folds, the lesser momentum along the lesser curvature and the greater momentum along the greater curvature. The surface which you are seeing is the anterosuperior surface. And if you make a cut in the layers of the greater momentum, that is between the anterior 2 and posterior 2 layers of greater momentum, then you can enter into a sac called the lesser sac, and the postero-inferior surface of stomach is related to that lesser sac. Now let us discuss a little bit about the lesser sac and the momenta that are contributing for the walls of the lesser sac. And in this picture, on the sagittal section of lesser sac, you will see the stomach and then the two layers of lesser momentum that are extending towards the lesser curvature of the stomach. One is the anterior layer, the other is the posterior layer. The anterior layer covering the superior surface of the stomach continues as the first layer of greater momentum, then as the fourth layer of greater momentum. Whereas the posterior layer, after covering the postero-inferior surface of the stomach, forms the second layer and then the third layer of the greater momentum, and this third layer you are seeing in relation with the posterior wall of the lesser sac in the sagittal section of lesser sac. Now let us see the transverse section of the lesser sac, so which is the posterior to the stomach, and then this is the anterosuperior surface, this is the postero-inferior surface, and then you are seeing certain of the structures in relation with the lesser sac, that is the spleen you are seeing, and then the kidney you are seeing. And with this brief background about the lesser sac, now let us go back to the stomach bed. Now in this picture you can see the abdominal cavity after opening it, and you can see this is the greater momentum and this is the stomach, and you can see the greater curvature with the attachment of the greater momentum. So this is the anterosuperior surface of the stomach. And then if you make a cut along the greater curvature in the greater momentum, then you can enter into the lesser sac, that is, and you can reflect the stomach upwards and you can see the posterior-inferior surface. So in relation with the posterior-inferior surface, you are seeing the lesser sac and then the structures that will be forming the bed for the stomach. We have defined the stomach bed as the one which the posterior-inferior surface of the stomach lies in supine position. That's what is the definition of the stomach bed. And now let us see the structures forming the stomach bed. In this picture, you can see the outline of the stomach shown in the dotted lines, and whatever structures that are shown here are related to the posterior-inferior surface of the stomach bed and forming the stomach bed. So they are the left crus of diaphragm, the left suprarenal gland, the splenic artery, the left kidney, the anterior surface of left kidney, and then the anterior layer of the transverse mesocolon, the left colic flexure, the gastric impression of the spleen, the anterior surface of body of the pancreas. These are the structures that are related to the stomach bed. And there is a mnemonic for those who cannot remember them. That is the Dr. S.S. Kumar takes care of student patients. So take the D and the two S, the K, the T, the C, the S and the P, and see the structures. So there is the left crus of diaphragm, the left suprarenal gland, the splenic artery, the left kidney, the transverse mesocolon, the left colic flexure, the spleen, gastric impression of spleen, then the body of the pancreas. So hope you have understood about the definition of stomach bed and the structures forming the stomach bed. Now let us answer the multiple choice question. All the following structures form stomach bed except splenic artery, celiac artery, left kidney and transverse mesocolon. So among these four, the correct answer, that is the one that does not form stomach bed, is the celiac artery. Hope you have understood about the stomach bed.